Today we are going to talk about a common eye issue, styes. A stye is a painful red swelling on the edge of your eyelid. Styes are filled with pus. Similar to an acne pimple, a stye forms when a tiny oil gland near your eyelash becomes blocked and gets infected with bacteria. Styes are very common and in many cases you can manage them at home. But some cases may require treatment by an eye doctor. Let's see about what they are, who's at risk, and how you can manage them at home. Hello everyone, I am Dr. Kalpana Suresh, Medical Director and Chief Ophthalmic Surgeon at Kalpana Eye Care Hospital, Chennai. There are two types of styes, external which forms along the edge of your eyelid and internal which is seen inside the lid. Styes are more common in adults than children because the oil in their glands is thicker, making it prone to blockage. It commonly presents as a painful swelling in the lids. Usually it doesn't affect the vision. Who are at risk for developing a stye? A person who requires spectacles for clear vision and is not wearing them constantly. When there is allergy along the lid margin called blepharitis, which is usually associated with scalp dandruff. A person with a diabetes, certain skin diseases, and some hormonal changes. To prevent styes, it's important to address these underlying conditions. Now let's talk about home remedies. A stye will usually go away by itself in 2 to 3 days. What can be done at home if one develops a stye? The most effective home remedy is applying hot compresses. You can do this using either the wet heat or dry heat method. For wet heat method, boil water, dip a clean towel, squeeze out the excessive water and apply it on the closed eyelid on the stye with little pressure on the swelling. By doing this, the heat will reach the blocked oil glands and melt its contents. This will help in clearing the thick secretions. The cloth should be sufficiently warm enough to reach the stye, which is deep inside. Otherwise, the heat may not reach the blocked oil gland. It will be ineffective. For dry heat, use an iron box to heat a clean towel and apply it in the same way. Using mild heat sources like keeping hot coffee mugs or air-blown towel are ineffective. It's important to address the common misconceptions about treating the styes. I have seen many people applying namakatti, that is tilak stick, to treat a stye, but this method is ineffective. Instead, it's best to use proven treatment like warm compresses and maintaining good eyelid hygiene. How long and how often the hot compresses should be repeated? You can apply 4 to 5 times a day, each session lasting for 10 to 15 minutes. Never squeeze the stye to express the contents as it can cause more harm. Although it will be tempting to cover the stye with makeup, ladies, please avoid doing this. Putting makeup on a stye can delay the healing process or even cause it to become more plugged and infected, which in turn will make it more painful. So avoid using the eye makeup when you develop a stye. Also, don't use contact lenses in the presence of stye as it can infect the lenses. It's preferable to use spectacles. When should you consult an eye specialist? When the stye keeps recurring, when it doesn't go away with hot compresses, when the whole eyelid is swollen, red and painful, and also when you have vision problem, and when you are diabetic, when the swelling becomes painless and is of long duration. After several months, the stye may become a chalazion. This is a painless swelling which will require surgical removal under local anesthesia. How to prevent a stye? Avoid touching your eyes unnecessarily. If you want to touch your eyes, do it after washing your hands. Make sure your contact lenses are clean. Throw away old cosmetics. Don't share your cosmetics with others. Remove the eye makeup at night. Treat the scalp dandruff. Keep your eyelids clean by using a mild soap like baby shampoo mixed with warm water. Gently clean your eyelids to remove any dirt or oil. If the stye persists or worsens, consult an eye specialist for proper care. Thank you for watching. Follow these tips to manage a stye at home, and if you have any questions, feel free to leave them in the comment box below. Stay healthy and take care of your eyes.